Good afternoon. I'm Bob Churchill, Dean of the School of Medicine here at the University of Missouri, and it is my distinct pleasure to welcome you here today. This is a celebratory event, and we want you to enjoy it. It is about you and someone you love who is about to become a physician. The faculty and I are just here to help you celebrate this tremendous achievement. We'll now hear from Lane Wilson, chosen by his classmates to offer a student welcome. Please help me welcome Lane Wilson.
It was my first day in pediatrics. I was doing my first month of the rotation in Rolla, and I was not expecting it to involve time in the newborn nursery. But as we know, medical school loves to throw curveballs. So there I was, in the newborn nursery, unprepared. My preceptor was busy with paperwork, hardly introduced himself, and told me to go ahead and look over one of the babies. So I picked one. This little baby and I had two things in common immediately. One, both of us had spent our first few days of life in that very nursery. And two, neither of us had any idea what was going on. It had been many years since I'd handled a baby that young, and I was scared. I was scared I wouldn't support that floppy little head enough, that he'd be fragile, that I'd upset him, that I'd have to change his diaper, and most likely of all, that everyone would be able to tell I had no clue what I was doing. Awkwardly, I unwrapped him from his blanket, started going through the motions of the exam. Of course, he got upset and angry and started crying. I rushed through the rest of the exam and picked him up, trying to quiet him down, handling him like he was a live bomb, as if nobody had experienced an upset baby in the nursery before. And as I was doing this, I noticed a woman staring at me through the window of the nursery. My heart started racing. I pretended I didn't see her at first. But soon she had everyone in the nursery's attention, banging on the glass, pointing at me, and mouthing, "Who is that?" I freaked out. This mom was coming to kill me. I put the baby back down, started to wrap him back up, realized I didn't know how to, so I did it like they wrap my burrito at Chipotle. And then I ran for cover back behind the nurse's station. My preceptor exited the secure area to go talk to the woman. When he came back, he told me, "She's 7 months pregnant, and she wants you to be her kid's pediatrician. She liked the way you handled the baby." I think if you asked all of us graduating here today what the hardest part of medical school was, you'd get a lot of different answers. But perhaps a common theme would be that in medical school, we're always facing fears. At the beginning, fears like working with a cadaver in an anatomy lab, later on board exams, talking to a patient the first time, touching a patient for the first time. After all, touching strangers like that previously would have gotten us on a database we don't want to be on. Fear of performing our first rectal exam. Fear of performing our second rectal exam. Fear of speaking up on rounds when we have a good idea no one else has mentioned. Fear of choosing the right specialty in residency program. Fear that Brett Sanders will post pictures of us on Facebook. Fear of the debt we'll face after we graduate. Fear that our patient has something bad or that we'll miss something. Maybe most of all, fear of balancing this with our personal lives and fears. My experience in the Rolla newborn nursery was a valuable lesson in fear. Not all fears are to be overcome. It's okay to be scared sometimes. We should be scared sometimes. And it's okay to let some of that fear show. The mother-to-be in Rolla who wanted me to be her kid's pediatrician knew nothing about me, except that I very awkwardly handled a baby in the nursery. But she could tell I was concerned about him, and that's what mattered to her. Patients want us to be afraid that they might have something serious. They want us to be afraid we might miss something. What they don't want is for us to be afraid to admit when we don't know something. I should not have panicked and run off when she started asking who I was. Perhaps it was harmless enough that day, But when we're residents, we can't let panic set in like that. Fear can drive us or it can paralyze us. And that day in the nursery, it did both to me. My classmates and I have shared many stories like this with one another and with the many of you in this room today. These stories are often funny, embarrassing, humiliating, but they've served an important purpose. I want to thank all of you who've shared your stories and for all of you who have listened to ours. For it's helped us to learn to live in fear so that our patients may live with a little less of it. Thank you all.
Well, I think everybody on the stage knows what it's like to be afraid. And some of us are always afraid, still afraid. And so, we can empathize with what you said. We have another special guest here with us today. I would like to introduce Curator Warren Erdman. He's the chairman of the University of Missouri Board of Curators, who is here to welcome all of you to this ceremony. Curator Erdman.
Well, thank you, Dean Churchill, for the introduction and for the enthusiasm and expertise and commitment that you bring to the University of Missouri School of Medicine. Distinguished faculty, graduates, your families, it's my honor and privilege to join you today as we celebrate the commencement of the University of Missouri School of Medicine class of 2011. On behalf of the University of Missouri Board of Curators and on behalf of the entire University of Missouri family, let me offer my congratulations and our heartfelt gratitude to each and every one of you. Today we celebrate your enormous success, your accomplishments, your hard work, and your achievement. We also want to welcome the many parents, friends, and loved ones who join you today to celebrate. Congratulations to you all. Among the many titles that you will earn and wear proudly in your lifetime, from this day forward, you may call yourself doctor. You should be very proud. With this title comes the honor and the responsibility instilled in you by our university to serve, heal, protect your fellow mankind. You have been well prepared for these tasks. The university's problem-solving learning curriculum, your exposure to patient care, and coursework that focuses you on interdisciplinary teamwork have put you in good stead. Your graduation today also gives you the distinction of now being part of a vast network of graduates that is 7,300 strong from this institution, but more than 500,000 when you consider the University of Missouri system alumni in more than 125 countries around the world. For some of you, commencement may mark the formal recognition of your efforts, but it will not mark the end of your education. Remember, too, that you now become ambassadors. Continue to tout the advantages of your higher education. Encourage young children to value their educations and use your knowledge to improve the world. To those whom much is given, much is expected. You all have been given a wonderful foundation for your future, but it's just the cornerstone. Build wisely, realize your potential, make your world a better place for the gifts you've been given. Once again, on behalf of the Board of Curators of the University of Missouri, we extend to you our heartfelt gratitude and our congratulations. We're counting on you. Congratulations and thank you.
Well, today marks a very special day, a very special accomplishment, and you should be proud of this achievement. You and I know that you did not get to this point all by yourself. Many along the way have given you love, support, encouragement, and money, and by this stage of the game, probably a lot of money. So today's joy and feelings of fulfillment are to be shared. They do not belong exclusively to our graduates. So, class of 2011, I would like you to stand and turn around and face family and friends. Take a moment to acknowledge those whose love, care, and all manner of support were instrumental in your being here today. Would the parents, spouses, and partners of today's graduates please stand? Any children of the graduates or other relatives, please also stand so that you too may be thanked. Please be seated. Late last night, Lindsay Monaghan sent me an email and wanted to make sure that I didn't forget about thanking FAMS, the Families Assisting Medical Students program organization. The FAM has been run lately by Debbie Korowski, Julie Kemerich. We want to thank all of the families who have participated in this program and have done so many things to support the medical students during exam times in their first 2 years. So we'd like to thank all of them. There is another large group of people also deserving of the gratitude of our graduates, for without them, no degrees would be awarded today, and they are seated behind me. Would the emeritus professors, the faculty, and the administration of the School of Medicine and University Health System please stand? Please be seated. I'd like to introduce some very special guests of ours who are seated on the stage. And the first, on the end, is Dr. Mike Misfeld, who is the Senior Associate Dean of Faculty Affairs at the University of Missouri School of Medicine. Next, we have Sally Hauser-Hanfelder, Director of the Harry S. Truman Memorial Veterans Hospital. Next, we have Dr. Stephen Smith. He's the president of our Medical Alumni Organization. Next, we have Dr. Michael Middleton, Deputy Chancellor of the University of Missouri-Columbia. Next is Dr. Hal Williamson, Vice Chancellor of the University of Missouri Health System. I would also like you to meet the leaders in the Dean's office who are responsible for all of our excellent education programs who will be assisting in today's ceremony. To my left, to my immediate right, Dr. Linda Hedrick, Helen May Spees, Distinguished Faculty Scholar and Senior Associate Dean for Education and Faculty Development. To my left, Dr. Rachel Brown, Associate Dean for Student Programs, Dr. Kimberly Hoffman, Associate Dean for Learning Strategies, and Dr. Jack Gay, Associate Dean for Curricular Improvement. Given an opportunity to select a member of the class to address them on this day, the class of 2011's choice is Lincoln Sheets. Please welcome Lincoln Sheets to the podium.
Dean Churchill is right that we wouldn't have made it to med school without you guys, our friends and our family. And of course, once we were here, we found a new family, a new big dysfunctional family, with our 96 new siblings and about 196 evil step-parents, the faculty and staff. So to honor them, I've prepared a handout and a PowerPoint with some little-known facts about your favorite teachers. I was going to break the news, but I think by now everybody has seen on WikiLeaks how the leaked documents about Dean Kimberly Hoffman, how she's the product of a superior intelligence, raised on a planet with lower gravity where humans grow up unbelievably tall and slender. It's the same place Dr. Salzer came from. You might not have known, however, that Dean Rachel Brown was actually born and raised in England. Or that Dr. Stephen Barnes was once in the military. Amazing, I know. Did you realize that Dr. Robin Blake once practiced medicine in the mountains of North Carolina? Little known facts, it's true. Our own Dean, Robert Churchill, once practiced medicine. That's right. He went to dean school right out of high school. He's working toward his childhood dream of being a dean. He made the dean's list, and then he took a brief detour into radiology and then returned to his true calling of deandom. His favorite singer, by the way, is Dean Martin. His favorite chef is Paula Deen. Okay, are you not laughing because the jokes aren't good, or are you afraid to laugh at these guys? You know, I'm just paying them back for what Dr. Rowland did, showing our Facebook photos at the senior banquet. You know, there's nothing they can do to us at this point. What, are they going to withhold our diplomas? I guess they could withhold my diploma. Well, anyway, okay, if you open your program to the 6th page of the program, there's a list. I'll just wait till you find the right page, the list of all the, there might be seems to be missing. I can't understand that. The OME printed this up for us, so I'm sure there couldn't be a mistake there. Well, okay. All right, so let's go on with the slideshow. I've got several great photos of our faculty. Those Facebook photos, wait till you see what I found on Dr. Rowland's Facebook page. We'll get this. The time, I'm almost finished. Yeah. Okay. Can you just turn on the projector? It's what? It's confiscated? Okay, well, that's about the end of my speech. I had a lot of good jokes here. The difference between an orthopedic surgeon and God. Difference between Dr. Stephen Barnes and God. Oh, wait, here's one for the ladies in my class. The difference, do you know the difference between Dr. Mark Beard and God? No, I didn't think so. Okay, so seriously, I want to convey our deep appreciation and admiration to all of you, to the faculty and to the staff that have literally made our medical education possible. All of us, wherever we go, will carry you in our hearts with us. And Abraham Lincoln said about his mother, and this is true of our teachers, that everything we are or hope to be, we owe to you. Thanks to you and congratulations to you, and I will see you guys in a year when they release my diploma and let me graduate.
Very good. This year, we have a very well-known MU graduate for our commencement speaker, and his name is Dr. Dan Longo. Dr. Longo received his bachelor's degree from Washington University in 1970 and his medical degree with honors from the University of Missouri in 1975. He trained in internal medicine at Harvard Medical School and Brigham and Women's Hospital in Boston. In medical oncology, he trained in medical oncology and hematology at the National Cancer Institute and did postdoctoral research training in the Laboratory of Immunology at the National Institute of Allergy and Infectious Diseases. He became a senior investigator at the National Cancer Institute in 1980, directed the Biological Response Modifiers Program of the National Cancer Institute for 11 years, and was scientific director at the National Institute on Aging from 1995 to 2010. Last year, he became deputy editor of the New England Journal of Medicine and senior physician at Brigham and Women's Hospital. Dr. Longo is an elected member of the American Society for Clinical Investigation and the Association of American Physicians, as well as a master of the American College of Physicians. He serves as an editor for Harrison's Principles of Internal Medicine and Cancer and Chemotherapy and Biotherapy Principles and Practices. It's with great pleasure, I'm delighted to welcome today's commencement speaker that was selected by the class of 2011, Dr. Dan Longo.
Thank you, Dr. Churchill, and good afternoon, faculty and families and students. I am thrilled to be here. This is a very, very big deal. People have already congratulated you and told you to be proud of yourselves, and I echo that. It's hard work to get through medical school. It's stress on families as well as individuals to make it, and your success in this is what I hope is one of many life achievements that you end up piling up. Medicine is, of course, one of the most gratifying and rewarding professions because of the help you're able to give to other people. Nothing impacts the quality of life quite like health. And as physicians, you'll be fortunate enough to restore some people back to full health. You may know that the motto of the University of Missouri is Salus Populi, which the school translates as welfare of the people, but salus is a word in Latin that also means health. Health and welfare are linked, both in etymology and in experience. A useful motto for physicians is attributed to Edward Trudeau, a TB physician who founded the Trudeau Institute in Saranac Lake. He also happens to be the grandfather of Gary Trudeau of Doonesbury fame. He wrote that the mission of a physician is to cure sometimes, to relieve often, and to comfort always. We're raised with the notion that primum non nocere, or first do no harm, is an important cornerstone of medicine, and it's attributed to Hippocrates. But he actually never said or wrote that advice anywhere. The closest he came to saying this was in his essay called Epidemics, in which he noted that the goal of the physician was to do good, or at least to do no harm. Making an effort to do good comes first. Everything we do to patients has the potential to harm them. Fortunately, a large fraction of what we do today has been validated by clinical research, unlike the mid-19th century when primum non nocere became the standard that was adopted. We routinely assess the risk-benefit ratio of various options and choose to intervene or not on that basis. But not even physical examination has zero risk. I once broke a patient's rib that was weakened by myeloma just by palpating it to follow up on his complaint of chest pain. In an effort to cure them of life-threatening illnesses, I have given patients much suffering with side effects from medications I've prescribed. Every diagnostic and therapeutic maneuver we do has some risk associated with it. If primum non nocere were our guiding principle, we would not be securing the benefits of modern medicine for our patients. A more appropriate guiding principle, in my view, is primum succurrere, which is first hasten to help. Patients need our help, and we must always be prepared to provide it. You will cure many patients with potentially fatal diseases. You will help patients reach important milestones in their lives, like a child's graduation or marriage or the birth of a grandchild. You will relieve symptoms and you will restore function. And sometimes you will just be there to hold someone's hand as they die. We're a privileged group. There is nothing else that compares with helping people feel better and live longer, and when that is not possible, providing a compassionate hand when they're beyond medicine's reach. But there remain challenges that we face. According to that eminent scholar, Alan Konigsberg, I just threw that in, it's really Woody Allen's name. Right now, more than at any other time in history, mankind faces a crossroads. One path leads to despair and utter hopelessness, the other to total annihilation. I pray we have the wisdom to choose correctly. I don't fully embrace Woody's gloomy outlook, but at times I do understand where it comes from. Half of what you have learned is wrong. We just don't know which half. When I sat where you're sitting, peptic ulcer disease was caused by acid and stress. Cancers that couldn't be cut out killed you, and HIV infection didn't exist. In the intervening years, both the infectious cause of and the cure for peptic ulcer disease has been identified. Advances in diagnosis and treatment have made it possible to cure 2/3 of patients with cancers. And HIV infection, initially viewed as a uniformly fatal worldwide scourge, became a treatable chronic disease. The progress in medicine in just the span of a single career has been staggering. No one can predict what comes next, and I'm not foolish enough to try, but I will say this. If doctors are permitted to do what doctors do, we are likely to keep changing the face of illness and its impact on patients, and to be prepared for new diseases and new insights about more familiar ones. But that if is a big one. Medicine is under siege from all sides. Our delivery of health care costs too much. The burgeoning of new information is occurring at a time when pressures on training programs mean that more must be learned in much less time. Care of patients has turned into care of organ systems. Every patient now has multiple physicians taking care of only a subset of his or her problems. New rules about the hours a trainee can spend taking care of patients means that a fundamental element of education is now gone. No internal medicine trainee now sees a single patient through the critical period of an episode of diabetic ketoacidosis. One has to piece together a picture of the illness and its management based upon seeing fragments of the care of different patients. Physicians are becoming shift workers, like grocery clerks and auto workers. At a time when there have never been more or better opportunities to help patients or more information that must be learned, concern about trainee fatigue has trumped the value of continuity of care, and the regulatory authorities have made that judgment despite a system of care delivery with several layers of more experienced backup, including fellow interns, residents, chief resident, attending physicians. They've decided that more mistakes in care delivery occur as a consequence of fatigue than occur due to the fragmentary communication of information from someone who actually worked up the patient to someone who's only covering the patient. But where are the data to support that conclusion? What are the consequences to the patient and to the trainee when the clock strikes and the young physician is required to go home in the middle of an acute illness? This focus on fatigue does not seem to me to be good for either the trainee or for the patient. The challenges to medicine are multiple. Drugs cost too much. Of course, drug development is an expensive proposition, and many good ideas fail when it's time to translate them into a treatment. However, it must be possible in an economic sense to provide guidelines on drug pricing that take the many variables into account. We simply can't continue to develop new drugs that, for example, in cancer, extend a patient's life by about 2 months and cost $20,000 a month or more to deliver. When colony stimulating factors were tested and found to save about 2 days of hospitalization, was it entirely by coincidence that a course of the agent cost about the same as 2 days of hospitalization? I don't think it was a coincidence. I think the drug companies used that opportunity and made up the price to fill that void. Drug companies spend millions of dollars developing drugs that are not more effective, but merely extend patentability. For example, a racemic mixture of drug X is effective at controlling nasal allergy symptoms. Is it a good use of society's time and money for the company to find that the D isomer is the active component and to make billions of dollars selling the newly named active isomer as if it's a new drug? I don't think that's right. Something must be done to improve the process of pricing drugs to allow their availability to all those who need them. And what's the contribution to healthcare costs of frivolous lawsuits filed on behalf of patients whose care was exactly what it should have been, but who are unhappy with the outcome of their disease? Certainly, fear of lawsuits is behind much of the overuse of diagnostic tests, which only further contributes to the cost of care. The doctor does not believe that a CT scan is really necessary, but one is ordered anyway just to be sure, which really translates as just to cover our tail. Tort reform is routinely promised by politicians trying to get elected, but somehow never delivered. Managed care programs present other challenges. In many centers, cost control efforts have produced clinical pathways or algorithms that dictate to the physician how he or she should work up a patient based on a particular symptom or complaint. The time physicians have to spend with their patients is only decreasing. Profitability depends on a certain volume of patient flow, such that you have precisely 12 minutes to see a patient, and the system does not have a way to accommodate alterations in the schedule. What if you discover the real reason behind the visit in minute 11? It takes some patients that long to work up the courage to discuss some particularly troubling symptoms they have. And what are you going to do? Ask the patient to make another appointment in 3 weeks? The point is, don't let the bean counters tell you how to practice medicine. You should be in charge. At the heart of the medical endeavor, it is the care of the patient that matters. Empathy and compassion are invaluable tools in a physician's armamentarium. I remember a lesson taught to me when I was a medical student by my intern, Mike. I had a patient who was a farmer from Kennett, and it was the time of year when he was usually harvesting his crop. He had subacute bacterial endocarditis, and at that time, that was a diagnosis that mandated 6 weeks of intravenous antibiotics in the hospital. Each day I would check his fever chart, go in and examine him, tell him what was wrong with him, tell him what the plan was, and each day he would ask me when he could go home. I was extremely frustrated that I was not able to explain the situation to him and make him understand. And I told this to my intern, Mike. Mike was an interesting man, very good doctor, and he had a diverse group of friends, including some people who lived on the edge of the law. Mike had an idea. One day he had a friend of his come to the hospital, and I'm working on the floor, and a guy bumps into me, and I says, "Excuse me," and I let it go. And a few minutes later, Mike says, "Well, let's go have lunch." And I routinely checked for my wallet and found it to be missing. So I was panicked, let's retrace my steps. What have I done? Where have I been? And Mike says, "Oh, don't worry about it. We'll find it. Let's go to lunch, but first let me tell you about the clotting scheme." Now, for those of you in the audience who don't know about the clotting scheme, it involves a complex cascade of proteins, one of which activates the next, which activates the next, and so on. And the proteins don't have names that facilitate easy learning. There's only one way to learn it, and that's by rote. And so Mike starts to teach me about the clotting scheme. 2 minutes into his lecture, I stop him and I say, "Mike, I'm sorry, I can't concentrate on what you're saying because I'm so worried about my wallet." Then he hands me my wallet and says, "Now you know how your patient feels." So this is a lesson that for me was indelible, and I hope it helps you to put yourself in the role of a patient and understand why it's so hard to explain things to them sometime. So Woody Allen's dilemma, hopelessness versus extinction, thankfully is not our dilemma. We have real choices. Our choices are not simple. All the consequences are not clear. Treacherous territory lies ahead of us, and no one is quite sure how things will change, but change they will. And we must keep our collective eye on the primary goal of bringing comfort to those who are ill and preventing illness in those who are well. It's customary for commencement speeches to include some advice. I'm sure most of you are more than ready to get on with the celebration of your big day, but here are some parting thoughts. First, be nice to people. The golden rule is golden for a reason. Its converse is also true. Don't treat other people in ways that you wouldn't like to be treated. Some people have called this the silver rule. Second, always be learning. Happily, our collective ignorance is getting a little smaller every day. Don't get left behind. Keep working at getting smarter. There's always more to learn. Third, be humble. You don't know a lot of things that other people know. You may be terrific, but that doesn't mean you couldn't be better. Fourth, listen to people, particularly your patients. If you just let them talk a while without interrupting them, they will tell you what is wrong with them. The most common error in medicine is that doctors do not let patients tell their stories in their own way. Fifth, strive for some balance in your life. Work is important, but so is play. Try to develop a stable domestic relationship. Get involved in your community. Life is a group activity. Finally, have fun. You've joined a special and privileged group. Use the force for good. Thank you.
Dr. Longo, I think that was one of the best commencement speeches I think I've heard in this auditorium in the last 23 years. general public undoubtedly thinks first of the Hippocratic Oath at a medical school graduation. Indeed, I took the Hippocratic Oath when I graduated from medical school. There are, in fact, several similar oaths that are also administered. Many feel that the wordings of these alternative oaths are preferable because they are more contemporary in language. At the University of Missouri School of Medicine, we ask our graduating class to select the oath that they would like to take. For many years, MU seniors have selected the Oath of Geneva. Now, we are about ready to take this oath. And I want to make sure that everybody understands what you're signing up for. This is pretty serious stuff from now on. And the oath is just words. And the oath can't cover everything in the space allotted. There is a lot more behind the words. There's an implied oath that is not necessarily written down. And I think as I was listening to Dr. Longo's speech today, if you listen carefully, those are the kinds of things that it's up to you. They're not written down, but they're part of the oath, as far as I'm concerned. And so at this time, the oath is printed on the back of the program, and because of the solemnity of this moment, I'd like the platform party and the audience to stand and follow along as I administered the Oath of Geneva to the class of 2011. So I'm going to read a phrase and then you repeat it. The reason I bring this up, it didn't work that way last year at the very beginning, so repeat after me. At the time of being admitted as a member of the medical profession, I solemnly pledge myself to consecrate my life to the service of humanity. I will give to my teachers the respect and gratitude which is their due. I will practice my profession with conscience and dignity. The health of my patient will be my first consideration. I will respect the secrets which are confided in me. I will maintain, by all the means in my power, the honor and noble traditions of the medical profession. My colleagues will be my brothers and sisters. I will not permit consideration of religion, nationality, race, party politics, or social standing to intervene between my duty and my patient. I will maintain the utmost respect for human life. Even under threat, I will not use my medical knowledge contrary to the laws of humanity. I make these promises solemnly, freely, and upon my honor. Please be seated.
Good afternoon. We are nearing the time at which each graduate will be recognized. One by one, each member of the graduating class of 2011 will be invited to come to the stage, will receive the doctoral hood and the diploma of Doctor of Medicine. Wearing a hood as part of the academic regalia signifies achievement of the doctoral degree. The color of the velvet decoration on the outside of the hood indicates which degree the wearer has earned. In this case, green for medicine. The silk lining on the inside, the color of that lining, depends on the school at which the degree has been earned. And each of the members of the class of 2011 University of Missouri School of Medicine will receive a hood with a black and gold lining, just like the one being worn by Dr. Longo today and by the members of the faculty up here on stage who are proud alumni of this School of Medicine. Each year, the graduating class honors members of the faculty by electing them as investiture marshals. Those members of the faculty assist with the donning of the doctoral hoods. And before we proceed, it is my privilege to introduce the investiture marshals for the class of 2011. Dr. Ted Groshong, will you please stand? Dr. Groshong has been a member of the faculty of the School of Medicine for 36 years, serving in many key leadership roles, including chair of the Department of Child Health and Associate Dean for Medical Education. Dr. Groshong currently is Associate Dean for Alumni Affairs. His awards include several of significance from the students: the Gold Foundation Humanism in Medicine Award, the Jane Hickman Teaching Award, which historically is the highest recognition of excellence in medical student education here at the University of Missouri, and selection by the graduating class as investiture marshal year after year after year after year. Congratulations, Dr. Groshong. Dr. Ann Havey, would you please stand? Dr. Havey is Clinical Associate Professor of Pathology. She completed her residency here at MU and joined the faculty in 1982. She also has had many education leadership roles and currently serves as the Pathology Education Coordinator for years 1 and 2 of the medical school curriculum. Dr. Havey is famous for her teaching excellence. She has 10, count them, 10 Golden Apple Awards and 6 Paul C.J. Sun Distinguished Faculty Awards for Education, including one presented by the students yesterday. She also is a recipient of the Jane Hickman Teaching Award. Congratulations, Dr. Havey. Dr. Michael Hosokawa, would you please stand? Dr. Hosokawa is Professor of Family and Community Medicine. He's been on the faculty for 37 years and served as the Associate Dean for Curriculum for 17 of those years. Dr. Hosokawa is considered by many to be the father of the School of Medicine's famous problem-based learning curriculum. A former dean once described him as, quote, one of my heroes for the critical role he played in designing and implementing the PBL curriculum at our medical school. Dr. Hosokawa also is a recipient of the Jane Hickman Teaching Award, as well as the Robert N. McCollum Student Advocacy Award. Congratulations, Dr. Hosokawa. This is an important occasion and a particularly joyous one, so please feel free to applaud. As members of the class of 2011 receive their doctoral hoods and diplomas, families, friends, and other well-wishers are encouraged to help make this moment a memorable one. Okay, are we ready? Let's go. Dean Churchill, honored guests, ladies and gentlemen, on behalf of the faculty of the University of Missouri School of Medicine, it is my privilege to present to you the members of the class of 2011.
So good afternoon. It's my great pleasure and honor to be the one who gets to read the names of the graduating class of 2011, soon to be my colleagues. Would the front row of the graduating class of 2011 please rise and approach the platform? Blake Barnes. William Mark Barnett. Our next graduate will be hooded by his father, Dr. Jeffrey Becker, graduating class of 1976. Jacob Becker. Lucas Buffer. Jennifer Bickhouse. Our next graduate will be hooded by her father, Dr. Douglas Bradley, graduating class of 1980. Sarah Bradley. Jordan Brown. Matthew Brown. Christopher Brownsworth. Christopher Buchanan. Joshua Bunch. Brent Bushman. Stephanie Carstens. Carter Kasma. Matt Clark. Jamie Custer. Pete Dawson. Kristin Dieteker. Emily Doucette. Dieter Duff. Ishvina Dougal. Whitney Fanshawe. William Fisher. Kelsey Flint. Spencer Gaskin. Benjamin Gerber. Emily Geller. Nathan Graneman. Julia Halsey. Eric Travis Hansen. Bonnie Nicole Welch Heithold. Randall Heller. David Holland. Vincent Horn. David Ingram. Jessica Johnson. Kimberly Kaiser. Jean Kelchin. Philip Kelchin. Shelby Cluis. Eric Ladd. Kevin Lees. Megan Lent. Aaron Lapine. Marianne Lopez. Daniel Leaders. Monica Lusiak. Elizabeth Hart Mahan. Catherine Malin. Irene Mannering. Lindsay Martin. Matthew Casey Martinez. Fallon Mayab. Trevin Mayab. Robert McCullough. Amanda Michael. Ashley Millam. Lindsay Monaghan. Our next graduate will be hooded by her father, Dr. Carl Myers, from our graduating class of 1974. Katie Myers. Jason Newman. Paul Nielsen. Courtney Orschlin. Emily Orschlin. Catherine Pade. Justin Purdy. Jacob Radel. Sherry Ritter. Jason Rodier. Megan Rooney Thompson. Manisha Sabawal. Andrew Sack. Brett Sanders. Kayla Schleicher. Joseph Sherger. Aaron Scott. Adam Scroggin. Zachary Shinitkovich. Neil Shea. Lincoln Sheets. Amanda Shipp. Srijana Shrestha. Ryan Siebert. Matthew Simmons. Alexis Simon. Kevin Stockard. Timothy Todd. Aaron Toth. Amanda Turner. James Walton. Joseph Lane Wilson. and Hayley Wolfe. That concludes the presentation of hoods and diplomas. I'd ask Dr. Churchill to come forward and complete the ceremony. Thank you, everybody.
It's not quite official yet. Now comes the best part, really the best part. Would the class please rise? With the authority vested by the Board of Curators, it is my privilege to now formally confer upon each graduating senior the degree Doctor of Medicine, with all of the rights and privileges pertaining thereto. Congratulations, Class 2011. Kind of looked like Annapolis out there for a little bit. I know many of you were at the honors ceremony convocation yesterday, and we actually save a few for today that are very special. And so your program includes a list of all of yesterday's award winners. And so today we have a few more, and I will be presenting these awards. First, the Dean's Award for Outstanding Achievement in Academic and Clinical Proficiency. This award is given to the student with the best academic record throughout medical school. This award goes to Lindsay Monaghan. Next is the Holt Leadership Award. This award is provided by two alumni of the School of Medicine, Drs. Gene and Richard Holt. Dr. Gene Holt is a faculty member at the University of Texas in San Antonio. Dr. Richard Holt is Executive Vice President for the American Academy of Otolaryngology in Alexandria, Virginia. This award is presented to a graduating student who has the best exemplified the highest moral, ethical, and leadership traits, and who has served as a peer role model. This individual has served in a leadership role in student organizations and has provided service to the medical school above and beyond the normal call. The award winner is chosen by Drs. Gene and Richard Holt from a list provided by the Faculty Awards and Scholarship Committee. This year, they decided to award two Holt Leadership Awards. The awards today go to Dr. Lane Wilson and Dr. Shelby Cluis. Huh? Right. No. I'm sorry. Okay. All right. Thank you. Next is the Student Leadership Award. This award is presented to a member of the graduating class who has been selected by a vote of his or her classmates on the following criteria: evidence of leadership qualities, peer acceptance as a potential leader in professional activities, a student who is a doer, and one who characteristically assumes leadership in the formal day-to-day activities of the student community. This year's award goes to Dr. Lincoln Sheets. He just confirmed that his tube was indeed empty, so we'll see him back next year. We're kidding. Now, to close the graduation ceremony, the class of 2011 has chosen Dr. Lindsay Monaghan to close the ceremony. Would Lindsay please come to the podium?
Today, we've thanked our classmates, our family, our friends, and our teachers. And finally today, it's my privilege to thank our patients. It's become a bit trite to say that they're our greatest teachers of all, but that makes it nonetheless true. It is our patients who humored us through our first awkward histories and physicals, who trusted us with their personal secrets, who allowed us to put a face with a disease we had only read about in textbooks. They're who restrained themselves from beating us with their IV poles when we woke them up at 5 a.m. to ask if they had passed gas. And it's them who allowed us to literally touch their hearts while they figuratively touched ours in return. Today I want to tell you about a patient who never even met me and one I never even spoke to, but yet one that taught me one of my greatest lessons in medical school. During my surgery rotation, I spent a week on the burn unit, and while I was there, I cared for a woman with over 70% of her body burned. On my first day of the rotation, we were taking her back to the OR to do some initial debridement. Now, burn surgeries are very messy, so we all suited up in knee-high booties, surgical gowns, face masks, goggles, hairnets. And the other thing about burn surgeries is that burn patients can't maintain their own body temperature, so the OR is literally 100 degrees. When I stepped into the OR for the first time, I thought, this is it. Goodbye, world. I will not survive this. Or, in the immortal words of Christopher Buchanan, Dr. Johnson, I'm going down! Yet somehow, I remained upright, and I managed to survive the several hours of the 100-degree surgery. As the sweat trickled down my back and everywhere else, I figured out what one of the nurses meant earlier when he asked me if I had brought an extra pair of underwear to work, which I had thought was kind of weird. And this was just the first of 3 very long and hot surgeries I experienced with that patient this week. But what I learned in the OR as I sweat through my scrubs and I looked around at the doctors and the nurses and the scrub techs was that medicine is an act of love. There is no other possible explanation for why someone would put themselves through something like that, but for the love of another human being. And medical school has not totally been unlike a 100-degree OR. Why did you endure 16 8-hour PBL tests, the gauntlet of step 1, 30-hour trauma calls, merciless pimp sessions by Dr. Barnes? There may be many reasons and motivations that got you to where you sit today, but ultimately, when you think back to what started you on this journey, it was love for people. You did it because when the time comes that someone in need comes to you, you will be a competent and compassionate physician who's able to offer the cure and comfort that they need. But just like in a marriage, love is not just a feeling, but a choice. And it is a choice you are going to make every day for the rest of your career. As you well know by now, all your patients are not naturally lovable. And it is especially those patients that are the most unlovely, the ones that are mean and non-compliant and smelly and ungrateful, who need that love the most. I think at some point during medical training, we tend to forget that it's not a question of whether a patient is deserving of your compassion, but whether you are worthy of serving another human being at their most vulnerable and significant moments. Now and every day, this choice will lay before you. Will you go to work every day driven by money, routine, or expectations? Or will you go ready to recognize the human being in each of the patients you encounter, choosing to love each of them, and thus honoring the great responsibility that has now been given to you? Class of 2011, it has been an honor to learn alongside you, and it is now my honor to work alongside you as fellow physicians. Thank you and congratulations.
Well, this concludes our commencement ceremony for today. We don't take a head count, but I'm not sure I've ever seen more people who have been at commencement ceremony for the School of Medicine in Jesse Hall all the years I've been here. So I want to thank everyone for coming. We are certainly honored that so many of you have decided to come and share this ceremony with our graduates. I'm sure they all appreciate it. I know we all appreciate seeing all of you here. I'd like to invite all of you to stay for a reception in the atrium of Jesse Hall. And so that concludes today's ceremony. Hope to see you later. Thank you.